I am Jamala Kim S. Aldis, your student nurse from Camarines Sur Polytechnic Colleges. So for today, I am going to demonstrate the heat application or the applying of hot water bag to the patient. So without further ado, let's get started. Then next, after knowing the procedure, we need to assess our patient. So we need to determine if the client's ability can tolerate the therapy. So we will ask the patient, so what is her tolerance to thermal procedure. So since we have this heat application, we must know if the patient can tolerate this amount of procedure that we are going to apply. Then next, we need to assess whatever conditions that might contraindicate treatment to the patient. So it includes the bleeding, circulatory impairment. So if the client has open wound, we cannot place a hot water bag to the affected area of the patient. So since our patient has only dysmenorrhea, there is no open wound and there is no bleeding, so we can apply the hot water application. Then next, we need to assess the skin area to which the heat or cold will be applied. So we need to assess the abdomen part of the patient. So ma'am, I'm going to assess your abdomen part. So I'm going to check your abdomen part if there are any presence of redness or blister. So allow me to assess your abdomen, ma'am. Okay ma'am, ito-check ko lang po kung merong mga redness or blister po. Okay. So as I observe, there is no presence of blister of the patient, and also there is no redness. So then next, we need to ask the patient to report any discomfort. So ma'am, will you tell me anything during and after the procedure? So if there are any discomfort po during the procedure, and also you can always tell it to me, ma'am, so that I can also report it to the doctor, so that we can provide you an appropriate intervention.
Okay, before going to perform the procedure, we need to determine if there are leaks in our equipment. So since we are going to use a hot water bag, we need to test or check this hot water bag. So I'm going to fill this hot water bag with water. So let's just assume that I'm going to fill this water from the sink of nursing station. Okay, then close the hot water bag. Then I'm going to turn this upside and down. Okay, there is no linkage. Then next, I am going to check each corner of the hot water bag. Okay, as I observe, there is no presence of linkage. Okay, then now we can remove the water from the hot water bag. So I'm going to remove the water. So let's just assume that I am going to remove the water from the sink of nursing station. Okay, so this hot water bag has no linkage. So after checking the hot water bag, we need to gather all the equipment. So the things that we are going to use is the bath thermometer. So the bath thermometer, it is used to measure the temperature of the water. So this is the bath thermometer. Then next, we need a towel or the cloth cover. Then of course we have this hot water bag. Then of course, since we have this hot water bag, we have this hot water. So then next, after gathering all the equipment, we need to place this to the patient bedside.
Okay, so first introduce yourself to the client and verify the client's identity. So good day ma'am, I am Jamala Kim S. Aldis, your student nurse from Camarines Sur Polytechnic Colleges. So ma'am, can I please verify your identity? So ma'am, can you please state your first name, middle name, and then your surname?
Camille Escobanes Ahola.
Okay ma'am, then how about your birthday po?
October 10, 2002.
Okay ma'am, then how about your age po?
19 years old.
Okay, ma'am. Okay. Then next, explain the procedure to the clients and why it is necessary and how the clients can cooperate. So I'll just explain the procedure to you, ma'am. So I am going to apply the hot water bag on your hypogastric part, so that we can provide you comfort and to relieve your pain. Then next, ma'am, you can cooperate with me, ma'am, by following the instruction during the procedure. Then next, perform the hand hygiene. So, okay, before I came here, I already performed the hand hygiene to prevent the transmission of microorganisms from one patient to another. Then observe other appropriate infection control procedures. Then provide the client's privacy. So I already closed the window and I already closed the door of the room. So to make the patient comfortable and make her safe. Then so this is how we place the hot water bag to the patient. So first, we need to measure the temperature of the water using the bath thermometer. So I'm just going to place the bath thermometer deep to the water. Then let's just wait a few minutes until it reaches the maximum temperature. So since we have this hot water bag, so the temperature for an adult is 46 to 50 degrees temperature. Okay, so it is 46 degrees Celsius. So then now we can, it is normal range. So then now we can use this hot water for our patient. So it is not too cold and it is not too hot. Okay, then next we are going to fill the bag about 2/3 full. So I'm just going to fill the water into the hot water bag into 2/3 full. So okay, so we need to measure it. So 1, 2, 3. So this is the point of the 2/3 full. So I'm just going to fill the water to the hot water bag. So this is the so this is how we fill the water into 2/3 full. So it's just at this point. As you can see, it is only in the middle. And it is only in the middle half. Okay, then next we are going to expel the remaining air and secure the top with the air removed. So we're just going to fold this hot water bag to expel the air. So okay. So the air flows outside from the mouth of the hot water bag. So we're just going to fold this body part of the hot water bag to expel the remaining air. As I can see that the water flows out from the mouth of the hot water bag. So we're just going to expel the remaining air of the hot water bag. Then fold the hot water bag like this. Then put the cup of the hot water bag and secure it tightly. So can see, the hot water bag is flat. It means that there is no air. Then next, we need to dry the mouth of the hot water bag. Then also we need to dry the body parts of the hot water bag. Then we need to turn this upside and down to check if there is a linkage. So okay, so it's secured tightly and there is no linkage present. Then next, wrap the bag in a towel or cover its sides. Then fold it. So now we can apply or place the hot water bag to the patient. So but before that, we need to tell the patient that we are going to place the hot water bag to the abdomen part. To the abdomen part of the patient. Okay, ma'am, I already prepared the hot water bag. So, ma'am, I'm going to place it to your abdomen part. So, first, unfold the drape of the patient and expose the area. So, ma'am, I'm going to place the hot water bag to your affected side. Ma'am, can you hold this for me? Then next, we need to apply this hot water bag for about 15 to 13 minutes before removal, and also depends on the doctor's order. So, ma'am, ma'am, do you feel any discomfort or pain po? Okay, that's good to know, ma'am. So, ma'am, always report me on what you are condition so that we can provide you necessary intervention. So, I'm just going to leave for a while, ma'am. So, I'll be right back again, ma'am. Okay, ma'am, it's already okay, ma'am, it's already 15 minutes. I'm going to recheck if there is a presence of blister or redness. Okay. Okay, as I can see, there is no presence of blister and redness. So ma'am, do you feel any discomfort or pain po? Okay, that's good to know, ma'am. So, ma'am, I will be leave you for a while again, ma'am. But this time, I'm going to ask the doctor's order. So, ma'am, I'm going to leave you for a while again. So, I'll be right back after 15 minutes. So now, we can remove the hot water bag for after the 15 to 30 minutes in accordance of agency protocol. So, ma'am, I'm going to remove your hot water bag. And I'm going to check again, ma'am, if there are any presence of blister or redness. Okay. Okay, as I observe and check, there is no presence of blister and redness. So, So, ma'am, I'm going to document all your findings. And also, I'm going to check the state condition of the patient. Then, lastly, I'm going to remove all the equipment and clear all the things. So that concludes my demonstration on applying the hot water bag to the patient.